Hey everyone, welcome to the Front Row with Ed. My name is Ed DeBoo out of Integrated Physical Therapy in beautiful Bellingham, Washington. I've got a three-part video series and they're all going to be dealing with shoulder injuries. So more than likely if you're watching this you're having some sort of shoulder pain or discomfort. And the rotator cuff is almost always involved with any type of shoulder pain or discomfort unless proven innocent. So we can always assume there's some sort of rotator cuff pathology. Now, the first part of the video, I'm going to talk about what exactly is the rotator cuff and what it does. The supraspinatus lives right underneath and through here. The infraspinatus lives right through here. Then we have a teres minor, and then the subscapularis sits on the inside of this scapula, kind of deep. 3 of the 4 muscles are responsible for externally rotating the shoulder. The subscapularis is involved in internally rotating the shoulder. Let's take a second and let's meet the muscle. The first muscle the rotator cuff we'll talk about is the teres minor, and here you can see it highlighted in orange. It's a small muscle underneath the lateral part of the scapula. Then we have the subscapularis, which sits on the front undersurface of the scapula and attaches onto the humerus, and it's an internal rotator. Then we go to the infraspinatus, which sits in the bulky part of your scapula or shoulder blade, and it's a common place for trigger points. And then finally we have the supraspinatus tendon, and this is the one that's most commonly injured. As you can see, it goes right underneath the roof of the acromion. The rotator cuff is responsible for externally and internally rotating the humeral head in the socket. It's also a big stabilizer of the shoulder, especially with any type of overhead motion or throwing action. One thing to remember too is that as we age, the likelihood of rotator cuff injuries goes up significantly. There's about a 30% chance of injury if you're over the age of 60. Once you get over the age of 70, there's about a 50% chance of a rotator cuff injury and tear. And if you're over the age of 80, there's about an 80% chance that you have some sort of pathology or possibly even a tear of the rotator cuff. So how do we prevent all this or minimize our chances? And that's by strengthening the rotator cuff. So the second part of this video, I'm going to talk about how to strengthen the rotator cuff.